Proactive Health Communication Campaign, Promotion of Resiliency in Healthcare Providers, presented by Lara Turner, RN, as a student of Brandman University in affiliation with the Chapman University System. Stress is a normal component of life, and as such, occupational stress is also a normal component. This becomes an issue when the stress exceeds an individual's ability to adapt effectively and cope. The promotion of resiliency in healthcare providers becomes relevant in that prolonged stress has long-term health effects upon individuals. Stress and burnout in healthcare providers has consequences for providers and for their clients. The use of a health promotion model provides a framework for addressing the promotion of resiliency and recognition of burnout in providers. Multiple approaches are needed to address the issue. It's important to know that collectively all healthcare providers experience stress and burnout, but for the purpose of this presentation, the primary focus is upon nursing. Resiliency is the ability that individuals exhibit to effectively adapt to life stressors in ways that continue to support individual optimal health. Individual coping behaviors are a combination of learned socialization and individual adapted behaviors. Long-term stress has consequences for the healthcare provider, for the team members within the healthcare team, and for clients that are cared for by that individual. In a 2018 survey of 900 nurses, data supported that there were symptoms experienced by nursing such as insomnia, chronic fatigue, forgetfulness or impaired concentration, increased illness, loss of appetite, anxiety, depression, anger, irritability towards coworkers, and other symptoms of stress within the population. When considering promotion of resiliency in healthcare providers, it should be important to note that provider stress and burnout are linked to medical error, associated healthcare infections, reduced client satisfaction, increased staff turnover, and increases in overall healthcare cost. Symptoms that are exhibited of stress include digestive problems, anxiety, headaches, depression, sleep problems, weight gain, memory and concentration issues, high blood pressure, heart disease, and stroke. All individuals exhibit some level of resiliency, while others exhibit larger levels. The use of Pinder's health promotion model as it's applied to individual resiliency. It's important to note that Pinder's health promotion model is based on a social cognitive theory, and as such it has 4 pillars. Individuals seek to actively regulate their behavior. Individuals in all their biopsychosocial complexity interact with the environment, progressively transforming the environment as well as being transformed over time. Health professionals, such as nurses, constitute a part of the interpersonal environment which exerts influence on people throughout their lifespan. And self-initiated reconfiguration of the personal environmental interactive patterns are essential to changing behavior. In using Pinder for provider resiliency, there are 13 theoretical statements that come from this model. They provide the basis for investigative work on health behaviors. Included within this are social cognitive theory statements such as active regulated affect are negative and or positive feelings that occur during the following behavior. Environmental impacts such as situational influences, commitment to plans of action, peer and support systems, interpersonal influences, and health promotion behaviors. Perceptions of success. Individual perceptions of benefits and barriers to actions influence health behavior. And individuals' perceived self-efficacy influences behavior. And autonomy. Personal factors influence health promotion, which include biological, psychological, and social cultural. When seeking promotion of resiliency in healthcare providers, a multimedia approach to promote the resiliency is needed. In addressing individual resiliency, it is important to make interventions based on evidence-based tools which have been found to be effective in promotion of individual resiliency. Some of the tools to utilize in this situation include mindfulness. Mindfulness is the awareness that is the result of paying attention with purpose within a present moment in a non-judgmental way. When an individual approaches moment-to-moment experiences without judgment, it allows separation of automatic reactions without positive or negative judgment. The acceptance of the present without automatic judgment allows experiences to be viewed with openness, curiosity, and compassion. This approach to stress with mindfulness allows individuals to reduce their likelihood of compassion fatigue and burnout. Additional resources include cognitive behavioral therapy. Individual cognition is the basis for the development of emotional and behavioral responses. Awareness of this allows for adaptation to healthy responses to stressors. And additional coping mechanisms within the toolbox include diaphragmatic breathing, progressive muscle relaxation, recognition of negative thinking traps, the utilization of self-soothing behaviors, and dealing with thoughts and assumptions. Resiliency is affected by internal and external factors. Some of the internal factors that influence resiliency include individual optimism, sense of purpose, faith or spirituality, self-efficacy, coping behaviors, and flexibility. External factors which can influence resiliency include networks and social supports, workplace resources, workplace support, role models, and mentorship. In a 2010 study by Cameron and Browie, they identified 8 themes that impact nurse resiliency, which include experience, the amount of satisfaction obtained, a positive attitude or sense of faith, feelings of making a difference, leadership strategies such as debriefing, validating, and self-reflection, support from colleagues, mentors, and teams, insight and ability to recognize stressors, and maintaining a work-life balance. Using approaches to develop the resiliency in providers allows opportunity for success. The use of education, such as a blog posted on stress management linked to professional organizations, printable materials and handout materials within the blog, which relate to stress and burnout, staff education on stress management techniques, a workbook of behaviors and interventions for staff included for coping behaviors, the utilization of the Facebook page for team building and support called Stop Nurse Burnout, the demarginalization, continued focus on reducing the stigma related to mental health. The Institute of Mental Health has an 800 number, which allows individuals to communicate with people that are knowledgeable about mental health issues. There also is a live online chat option included in that. Buy-in by leadership and empowerment. Enhancement of meaningful work for staff. Fostering opportunity to participate in decision-making. Expressing confidence in individual high performance and staff high performance. Facilitating the organizational goals. And providing autonomy and freedom from bureaucratic restrictions. In utilizing a multimedia approach for strategies to adapt to promote resiliency, with a focus on a future healthier healthcare provider, the connection of resources is the first step. Joint Commission has issued a quick safety issue, which discusses burnout and nursing safety and resiliency from a clinical perspective, staff perspective, and leadership perspective. The ENA has developed a compassion fatigue campaign, including teaching materials. Twitter has established a clinical well-being, which focuses on clinicians across the board and resources for such. Buy-in and leadership support in providing education, promoting individual autonomy, supporting mastery, support and direct staff with purpose, fostering a safe work environment, the use of debriefings, promotion of team support and colleague support, development of mentoring and role models. Further education, such as the American Nurses Association, A Nurse's Guide to Preventing Compassion Fatigue, Moral Distress, and Burnout. The American Nurses Association has also developed a campaign with a focus upon healthy nurses, thus a healthy nation. And the National Academy of Medicine has developed a program focusing on clinician resiliency and well-being. Promotion of provider resiliency requires a multifaceted approach. Addressing stress and burnout within providers requires recognition of the issue, support from leadership, education, provision of resources, support within the medical community, and a multimedia approach. Included are a list of references, and finally, thank you. This is a way to contact me. Once again, thank you for your time.